Hello and welcome to Medcast Plus. I'm your host, Dr. Jack Braha. Here on Medcast Plus, we bring you local healthcare providers and physicians, experts in their fields, to help educate us on a number of medical topics. Today, we are pleased and honored to have Dr. Jagdeo. Dr. Jagdeo is a board-certified dermatologist and an expert in laser surgery and aesthetics. He was born here in Brooklyn, went to college, medical school, and graduate school at Brown University in Rhode Island, and then returned to Brooklyn to train in dermatology at SUNY Downstate. He then went across the country to UC Davis in California, where he was an associate professor of dermatology and continued his research on lasers and aesthetics. Brooklyn is lucky to have him back, now at SUNY Downstate, as the founding director of the Laser Aesthetics and Body Institute, and we are just so pleased to have you on the show, Dr. Jagdeo. The list to introduce you is long. Your resume is long.
Thank you.
You are an expert, and this is a topic today of dermatology, skincare, that a lot of our viewers have been asking about, talking about, and in my office, even in gastroenterology, everyone wants to know, what can we do to take care of our skin, the largest organ in our body? Talk to me. How is dermatology these days? What's new? What's on the horizon? What are you doing at Downstate?
Thank you so much for having me here, Dr. Braha. It's an absolute pleasure to be here and really chat with you about some of the finer things that are going on in dermatology. First of all, it's the summertime, and one of the things that I love to tell every patient is that now that the sun's out, make sure that your sunscreen is also out. Having the chance to use your sunscreen throughout the week and on the weekends as you're out having fun is one of the most important things that we as people can do to protect our skin from the sun.
And this starts not just in summer, but even before summer as the rays start to pick up, the sun's higher in the sky.
Absolutely. Using sunscreen throughout the year is one of the most important things that I recommend to patients. However, now in the summertime when we're really getting extended periods of sun, in terms of going to the beach, going on vacation, making sure that we're having fun just, in the city, it's so important to remember to reapply your sunscreen throughout the day. I oftentimes like to let my patients know to put their sunscreen on about 15 minutes before leaving the house in the morning when they're going out, about 15 minutes before having lunch, and then right before they leave work, another 15 minutes before they apply sunscreen. So
it really needs to be applied before we get into the sun so the body or the skin can have it absorbed or to lather on top. And so you need to plan ahead. Some of the common things that people ask, and I know our viewers are thinking about right now, is I walk in the aisle of a local drugstore and they've got 20 feet long, 4 rows high of so many different sunblocks, sunscreen, sun this, sun that. What is the basics? What do we really need? Tell us a number. Is there any name or is there any buzzwords we should be looking for?
So what I like to share with my patients is the best sunscreen is the sunscreen that they're able to use consistently every day. And using sunscreen every day is so important. There are so many different types of sunscreens out there. Being able to try the different sunscreens before you buy is always wonderful. Sometimes that's not always an option. What I like to recommend are mineral-based sunscreens that are fantastic and that blend in with your skin tone. One of my favorite recommendations is this L'Oreal SkinCeuticals Mineral UV Block Sunscreen. It's phenomenal. It blends in nicely with any skin tone. And one of the things that my patients often kind of bring up and raise as a very important topic is, Doc, these mineral sunscreens work wonderfully, but sometimes they leave this chalky residue. So it's very important for patients to find a sunscreen that works well for their skin type and so that patients can have a wonderful experience with sunscreen.
Yeah, I think that's true for all of us, is that it seems like a hassle to put this chalky, thick material on our bodies. And so a lot of us just blow it off. But really, down the road, decades even after heavy sun exposure, we see the damage in the skin. And so you recommend this mineral type of sunscreen, but find the one that works. We've got to use it, folks. Skin cancer is common. We see patients who have skin cancer all the time. We should all be getting skin checkups, correct?
You're absolutely right. Talking with patients about skin cancer with regards to sunscreen is very important. That's a very important topic. However, patients have been shown in studies to be much more receptive to using sunscreen when you let them know that using sunscreen helps delay aging and the appearance of aging with regards to their skin. You know, everybody wants to look their best and everybody wants to look good. And one of the keys to looking their best and looking good is to use an appropriate amount of sunscreen to help prevent the photoaging effects that the sun's ultraviolet rays and visible light rays and infrared rays cause on our skin.
So all these sun rays, which we enjoy being out on the beach, and everyone feels they look great with a tan and they want to look good, the damage is not now. It's later down the road where all these rays can have aging, and that's a key word because everyone wants to look younger, as you said.
Of course.
So using a bit of sunscreen now can save you money down the road trying to look younger.
Of
and we're going to
course.
get to that in a little bit in the show because you are an expert at maybe looking a little bit younger. And
Thank you.
I don't know if you could help me, but maybe some of our viewers. Is there a number on the sunscreen bottle that we have to pick? Is it 15, 30? We see all different things. What do we really need to pick?
So I like to make this simple for my patients. I like for patients to be able to easily decode those numbers. I like to tell them that those numbers are basically how long the sunscreen is going to be effective for. And so if you take a SPF 15, that might work for about 15 minutes. Most people are outside for more than 15 minutes at a time, and you don't want to be reapplying sunscreen every 15 minutes. So you want to at least take a number that's going to work for your lifestyle. Something that is at least SPF 30, but I like to recommend to patients SPF 50 or above is fantastic.
So that's important. SPF 50, you're going to plan on being outside for a while, going for a run, a bike ride on the beach, and even then you still need to reapply and be mindful, especially with the young kids. We know that even a bad sunburn, one sunburn at a young age can lead to a higher risk of cancer down the road.
Absolutely.
Should patients be checking their skin? Should they be asking the doctor? Should they ask primary care? Or should they come see a dermatologist for a skin checkup?
I think that every patient should definitely take a look at their own skin and have family members take a look at their skin as well for the areas that they can't see. Basically, everything on the backside of us is something that, you know, it's very challenging to see. So if you have a family member who can take a look, and especially during these summer months, let's say if we're going out to the beach, you want somebody to check and see at least once a year what's going on. Preferably a board-certified dermatologist. If your family practice doc or internist, while you're having your annual checkup, sees something suspicious, it'd be great if either they could biopsy it or have you make an appointment for an opportunity to be screened by a board-certified dermatologist who are experts in the skin. Being an expert in the skin really entails knowing what some of the subtle different nuances are in terms of looking at skin lesions and being able to tell if those are benign or cancerous.
Yeah, I think that's important. Even when I was training in primary care, we would learn a lot about dermatology. But the dermatologist, the person who specializes in this, is really so important because I've seen you guys walk into a room and there were 6 doctors a minute ago looking at a rash saying, hey, it could be this, it could be that, it could be this. And I've seen a dermatologist many times walk in and in 15 seconds give us the answer. And so when there's any question of a skin lesion that you or your doctor is not aware of, seeing a board-certified dermatologist, looking one up, there's plenty around, is really good advice. I agree with you. Let's move on to a topic that I'm sure everyone is sitting there right now waiting to hear about is how can we look younger? What, are there pills, potions, lasers as you do, injections? You know, what is out there today? What is in vogue? And I know you're doing a lot of research in lasers. You're an expert in laser surgery. So let's start off with what are some of the common ways in your practice that you're able to take care of scars or some of the signs of aging?
Jack, that is a wonderful transition. First of all, again, I want to reemphasize sunscreen and sun protective clothing, hats, long sleeve shirts, etc. are so important in preventing aging. Now,
but then we'd put you out of business if we prevented aging.
You know what? Everybody ages normally and gracefully. There are ways that when you come to see us as board-certified dermatologists that we can really help, you know, address different concerns. And, you know,
and people are, this is why they come to you. They're concerned about a blemish, a scar, some of the signs of aging, even if they did all the right things with sunscreen and skin protection. Here they are in your office, and you've got all these high-tech. Tell us about it.
So you're absolutely right, Jack. A lot of patients want to look their best, and they want a little help from a friend. And, you know, we board-certified dermatologists are the experts in the skin, and we're the experts in terms of aesthetic care. some of the things that we have available to us are lasers, different injectable devices, Botox as well. And these different things, when used together and used by experts, help to subtly refine the skin to help patients achieve their skincare goals.
So I want to look 29 again. Someone walks into your office and says, listen, I've got some wrinkles around my eyes, I've got some of the signs of aging, and I don't want to just go on the internet and buy some potion or powder. I'm not going to walk into one of these stores where they're selling snake oil saying, rub this on every day and you'll look 10 years younger instantly, because we all know that that's probably not true. But I'm in your office, I've got some wrinkles around my eyes, I want to look 29. I enjoyed being 29. What are some of the things you can offer me?
So for wrinkles around the eyes, one of the basically home run solutions for that is really the use of wrinkle relaxers, Botox, and other topical medications that can be injected that help relax those wrinkles, relax the muscles that are causing those wrinkles, and really giving the best outcome for the patients. There are other treatments as well, such as topical hyaluronic acid, which can help subtly fade away some of that etched-in look. But really, patients want to come on in, see their board-certified dermatologist, and really come up with a concrete plan of action that can help the patients achieve their skincare goals. Other things that can help remove wrinkles include different types of lasers.
So there's a few different approaches you could take. Probably you combine approaches, I'm sure. But I like the term wrinkle relaxers. I feel like if I just won the lottery, I'd have a wrinkle relaxer. But the chances of that are a lot lower than me walking into someone's office and maybe getting a Botox injection or putting on some topicals. But you brought up a good point here about board-certified dermatology, because I've had a number of patients who come in and they've gone to anybody out there who claims to be able to inject Botox, whether it's real Botox or not, whether they're injecting real fillers, and whether they're trained properly. Can we just go to anybody who says, I am able to inject? How should people feel comfortable with who they're hiring or going to take care of their skin?
So that's a great point. How do you determine, or how do patients determine, who's actually skilled in the art of aesthetics? And that is really one of the things that's very clouded right now in the aesthetic landscape. There are so many different people who claim to be experts, and there are so many different people who inject different products or say that they can perform different procedures to help patients look better. And some of those people may be trained, and some of those people may be minimally trained, and some of those people may have no training whatsoever. And it's really important. That's why you really want to go see somebody who is board certified. You want to check their credentials. A lot of right now what's going on is social media, and a lot of different photos are popping up and people injecting patients on social media, showing up on Instagram, Facebook, etc. And that's really good for growing awareness about these different treatments. However, not all of those people are actually core physicians who have been trained in aesthetics. Different people can do these treatments legally. However, it's always best for patients to really vet their physicians, because this is their body, this is their face, and you want to make sure that who is treating you has received the proper training to do these procedures.
Yeah, someone comes in to look good, we want them to leave looking good.
Absolutely.
And there can be complications that occur when they go for some of these treatments, particularly if they're going somewhere where it may not be the most ideal person or ideal place. And God forbid something should happen after going for an aesthetic treatment. You want the person who did it to be able to take care of or to recognize early to prevent any issues. And so, I always tell people, because I'll be at a dinner somewhere and they'll say, hey, who do you recommend for this or that? I've been going here, I've been going there. See a board-certified physician. I mean, that's the best credential I think you can get out there, because they went to medical school, they took the training, they've taken the exam, they keep up to date. All of us who work at hospitals have to get continuing education. We were talking about this on the drive over.
Absolutely.
About continuing medical education. So I want our viewers to hear when you say board-certified dermatologist, probably a good place to start when you're worried about how good you look and how much better you can. You're an expert in lasers, and we hear laser, laser, laser. What does that mean? What is a laser?
Lasers are basically concentrated forms of light energy that can be used to deliver skin changes. And what it can be used for really is to help refine and change the way that the skin actually is looking and functioning. And that can yield a variety of different benefits.
So here I am again. I want to look 29 still. I got my Botox or my botulinum injection, and my wrinkles now look a bit better, but I want my skin to look a bit younger. Lasers play a role here?
Absolutely. So there are different lasers and light-based devices and energy-based devices that can be used alone or in combination to help patients get their best skin. And what I oftentimes recommend is that patients come on in, again, to see a board-certified dermatologist, someone who specializes in aesthetics, so that they can have a consultation, so that they can be thoroughly evaluated, so that we can hear what the patient wants, what the patient is looking to achieve. One of my approaches to skincare and to the consultation whenever patients come in to see me is I really listen. I sit down with them. I really want to hear what their goals are, what their hopes and what their dreams are. This is their chance to really tell me and share with me what they would like to achieve and what they would like to enhance or refine, versus me sharing what my thoughts are. One of the things I like to do during the consultation is I oftentimes give the patient the mirror. And this is their chance, really, in an uninterrupted manner, to really take a look at themselves and decide what would they like to focus on for that visit. And then we put a plan together.
So I can't just pull up the mirror and say I want to look 29 still. I have to.
Well, I want to hear. I want to hear some of the different things that really you're focused on, not just age and not just a number, but how can we work together, because this is going to be a partnership, a relationship, to help you achieve whatever your goals are.
So that brings me to the next conversation, which is if someone walks in and says in the mirror, I've got a little scar here. Mm-hmm. Because there are plenty of people who have fallen down and had sutures put in, stitches put into their face or somewhere else in their body. And we hear a lot about this, of scarring. And people would like to have scars removed just like they have tattoos removed. Does laser play a role in this? Can you treat scars like that?
So absolutely. There are different lasers that do play a role in scar treatment and scar rehabilitation. One of my favorite lasers is a fractionated carbon dioxide laser. That's a class of laser that really vaporizes small pixelated matter on the skin to help promote younger, fresher skin to kind of regenerate in that place. And that's really the gold standard for the treatment of scars today. This really segues nicely into one of the other things that I'm so excited about and passionate about is the research that we've been engaged in for the past 10 years. This research started off at SUNY Downstate and continued on after my residency to the University of California, where we were engaged in research for 7 years focused on how can we treat scars in a non-invasive, easy way for patients that they can engage in this therapy at home.
And so they don't have to go under the knife.
They don't have to go under the knife or under the laser. So the
Tell us about this.
So let me tell you, one of the exciting things is that, you know, with this NIH-funded project, because, you know, we had such exciting laboratory data that, you know, was generated by the team of wonderful medical students, research fellows, and other faculty members who were colleagues.
And you.
Thank you.
Very important for our viewers to know you were a key role in this study.
Thank you. We as a team, but it's all about the team, because no one person really can advance science by themselves and advance medicine by themselves. And by working together as a team, we were able to discover that using light, visible light, at different wavelengths, we were able to change the way that the skin cells function that generate the physical characteristics of scarring. And by looking at this in the laboratory and studying some of the molecular findings, we were actually able to then translate that into a clinical trial, which is now ongoing at the State University of New York, where we are using red light-emitting diodes, red LEDs, to see and study if we're able to decrease scarring in patients after surgeries.
I know our viewers are saying that was a lot of technical jargon, but it sounds like to me,
Tell me.
You're able to start treating scarring or prevent scarring using just various wavelengths, different colors of light, not even lasers, not even going under the knife, which is incredibly minimally invasive.
Right.
It's really just not invasive.
Right.
That's really nice to hear. And this research is going on here in our hometown.
In Brooklyn.
In Brooklyn. Unbelievable.
So, SUNY Downstate.
SUNY Downstate, Brooklyn, you have some of the most advanced research going on in skin health, skin care. And so you're over at SUNY Downstate now with this new institute that you were part of starting. You see patients there?
Absolutely. We're seeing patients there for this clinical trial, and we're going to open up the larger institute hopefully early next year.
So patients out there who are thinking of having their scars treated one way or the other can consult with you possibly.
Absolutely.
And see if they're a candidate or see
Absolutely.
whatever options you can provide as an expert in treating this. So we talked a bit about sun health, avoiding the sun, or at least wearing sunscreen, proper sunblock, blocking clothing is also important. We talked about that because that could prevent the aging process a little bit, prevent people from having bad skin going forward by blocking the sun now. We talked a bit about injections that you can use to make me look 29 still. We talked a little bit about lasers and now light. So there really seems to be a lot in the toolbox these days to treat people who want to take care of their skin, take care of blemishes, scars. Tattoos. These can be removed now.
Absolutely.
How do you do that?
Different laser wavelengths, different types of light that are used via a laser device can remove tattoos. These wavelengths are specific to each color in the tattoo, and therefore you may need different lasers to remove different colors. But this happens over a series of treatments, usually 8 to 12 treatments, spread out by a month apart. And then these lasers kind of focus the beams onto the tattoo colors and pigments in the skin and kind of gently shatter those pigments until they're so small that they're finer than a grain of sand and they can't be seen by the eye.
So if I had a tattoo that says, love Jenny forever, and then Jenny stops loving me forever, you can remove.
We can remove them.
And if I find someone else, they can replace the name in the same
Absolutely.
area. So it's sort of like cut and paste or delete. These are things that we thought years ago you couldn't remove, and now here
with technology, here we are. We're able to do a lot of things that really help patients achieve their best lives. And when patients have tattoos that they're ready to get rid of and ready to move on from, we're here for them. And that's one of the things that we're excited to offer at the SUNY Downstate Laser Aesthetic and Body Institute.
So it sounds like the laser is really taking up many, many roles. Light therapy is taking up many roles. And we've seen light therapy used in other diseases in medicine, and here you are expanding it here in Brooklyn, incredibly, at the SUNY Downstate Medical Center at your institute there. In terms of cosmetics, if somebody goes for plastic surgery, if someone goes for some of these laser therapies, what are some of the potential side effects that they should look out for? What are some of the downsides? We talked about all these wonderful benefits, but fair and balanced, we should at least talk about what are some of the side effects that could occur.
So there are different side effects that can occur with laser therapy. Blistering, the sensation of a burn is the most common. Those usually resolve without any scars or problems. Just downtime. One of the things that every patient should know is that there's going to be some downtime with almost any laser procedure, whether or not that downtime is an hour or two of redness versus wound care that has to be taken care of in terms of helping the skin heal after the laser procedure so that patients can achieve their best and most optimal outcome.
So these are an important conversation that patients should also have with their doctor. It's not just how good can you make me look,
Absolutely.
How great will I be after this, but always to ask about what are some of the side effects. Will I be able to go to work the next day?
True.
And I'm sure that after some of these therapies, they can't go out in the sun possibly for
Right.
some time. So
For
maybe
a few days.
Right. So maybe if you've got some weekend plans out in Jones Beach or something, maybe not having a laser therapy done on Friday is a good idea.
So that's one of the most important parts of the consultation is really sitting down with the physician, chatting with them about, chatting with the patient about what their needs are. And when you both come together, patient and physician, on what your needs and what your goals are, then you put together a timeline, a treatment plan. And that always needs to include what sort of downtime there is, what the possible risks, benefits, and alternatives are.
And this is a conversation that is classic between patient and physician with all medical therapies, and that's why it's important to see a physician, a doctor, because they also provide full thickness care. They understand not just the skin, the injection, the laser. They understand all the diseases you have and how those diseases can also play a role, the medicines you take. And so when we see somebody who may not be a medical professional or a physician, we may be taking a gamble. And a board-certified dermatologist like Dr. Jagdeo should be the next step when someone says, I'd like to have a skin therapy done to remove a tattoo or to treat a scar or to make Dr. Braha look 29 again. I'm only going to you.
Thank you.
I'm biased because I know you for 10 years now. In full disclosure to our viewers, we've known each other since we were training.
Absolutely.
We met together in Brooklyn. We've been friends ever since, and I have the highest respect for you.
Thank you.
And what you and your colleagues are doing over at SUNY Downstate Medical Center in the dermatology world. And I want to thank you so much for being on the show. It's nice to talk about this. Tends to be a happy topic in medicine.
Thank you.
People wanting to look 29 again, which one day I will look 29 again, and you'll probably be the only person who can do it, I imagine.
Come see me.
You or one of the magicians out there, but we can work on that. So I'd like to thank you for watching this episode of Medcast Plus. I'm Dr. Jack Braha. It's been a pleasure to have you here watching our show with Dr. Jagdeo, an expert in laser skin care. You can follow him on social media, Dr. Jared Jagdeo. His name is at the bottom of the screen, Jared, J-A-R-E-D, Jagdeo, J-A-G-D-E-O. You can also find me on Instagram at GIJack. If you have any interest in our show, you can visit our website at medcastplus.com, check out our tools, and connect with us on social media. You can also reach us at 718-510-2103. I'm Dr. Braha, and from all of us at Medcast Plus, stay healthy. Thanks for watching.